I became interested in the LANAP protocol when I was actually giving a lecture at the Hawaii Dental Association, and I walked out and there was the Millennium booth right there. And, you know, I had heard talk of a laser protocol that could regenerate bone and kind of blew it off as voodoo. And at the time, Dr. Yuckna hadn't even published an article. It was a study, but I got a copy of it. And I looked at it and said, hey, you know, you can't fake histo. And so I called Dr. Yuckna, talked to him for about 45 minutes, and said he went in the biggest cynic and came out the biggest advocate based on the histo. Then I called Lloyd Tilt, and you know, he had been doing LANAP for X amount of years, and said it was a real deal, so I took a leap of faith and went to boot camp. I went home and started doing it and was just simply amazed at how good the post-ops were, and then when I started getting results, it surpassed all expectations. In general, my LANAP patients are pretty much euphoric from the standpoint that they had minimal, if any, post-surgical discomfort, maybe a little sore from the shots, having their mouth open, but from the protocol itself, there's minimal discomfort, and that thrills them, and what thrills them even more is when you show them down the road when you've regenerated bone for them. One gentleman, he was scared to death to go to some surgeon that's going to hack up his mouth. And so he knew he had gum disease and he didn't go for years. And then he heard about the LANAP protocol and came in and, as he states it, went up to the spaceship, let them work on me. And I saw the future. He says, I saw the future, and I've got good news, the future works. I've got my mouth back, and this is a great story, and he's really glad he did it. Another patient had an implant with about 85–90% bone loss, and I, at the time, said, I don't think it's worth treating, and she said, treat it. And we did, and we regenerated massive amounts of bone for her, and, you know, it's just a really exciting case. Well, if you treat any degree of periodontal disease in your practice, particularly if it's, you know, let's say a general dentist that's doing osseous, this is going to be a game changer, big time. It's going to be a game changer for the periodontist as well, because the procedure's easier on you physically. It's beneficial for the practitioner as well as the patient. With LANAP, you've got a procedure that's far less invasive, more predictable with regenerative capacity, infinitely less discomfort, and costs less to get similar results. How can you beat that? Costs less, works better, doesn't hurt.